Hello, and welcome to another episode of Boundless Body Radio. I'm your host, Casey Ruff, and today we have another amazing guest to introduce to you now. Beth McNally is a certified nutrition specialist professional, licensed nutritionist, founder of T1D Nutrition, creator of The Nutrition Effect, a parent's guide to food and normal blood glucose for children with type 1 diabetes, and most importantly, the mother of a teenage athlete living with type 1 diabetes. In her work as a clinician and educator, Beth specializes in helping parents safely and successfully implement therapeutic carbohydrate restriction nutrition strategies so they can help improve their child's quality of life, reduce the risks of long and short-term diabetic complications, and ease the stress of type 1 diabetes management, often for the entire family. At T1D Nutrition, tools are provided to help type 1 diabetics use therapeutic carbohydrate restriction, or TCR for short, as a low carbohydrate nutrition strategy specifically created to help safely achieve the ultimate goal when it comes to type 1 treatment, keeping blood glucose levels as close to normal as possible, all while providing your child with delicious, nutrient dense meals to help them grow, thrive, and reach their fullest potential. You can find Beth at her website at www.t1dnutrition.com. Beth McNally, what an absolute honor it is to welcome you to Boundless Body Radio.
Thanks, Casey. It's great to be here.
It is an honor to host you. This was a challenge to get coordinated because we're literally on opposite sides of the world. It is so challenging to try to find times to speak with people who are living in Australia. You're also from Canada in the Ottawa area, so we could spend the rest of the hour talking about hockey, which I absolutely love. But we're actually going to get right to the topic that we mentioned in the introduction, which is type 1 diabetes. As I said off air, this doesn't impact me personally. I'm fortunate that I don't currently know anybody who's going through type 1 diabetes. I've met tons of people in this space, in your space, who are dealing with this personally, and I've got to talk to so many of them, and I find it absolutely interesting. And I'll just kind of give you a bit of an example. It was a few weeks, well, maybe it was a few months ago. It was a few months ago. A Facebook friend, we're not very close. He, posted a picture of his son. It's the picture you see all the time. The kid's in the hospital. He's all hooked up to a whole bunch of tubes and everything. He's got the plate of waffles next to him, and the diagnosis has just come down that he has type 1 diabetes. The first stupid mistake I did is I reached out way sooner than I should have. I wish I would have set a timer in my phone to say, like, 6 months from now, reach out to this guy and offer help. I immediately reached out and said, hey, man, this is terrible. Let me send you a documentary you can watch. Diabetes Solutions, really great. I'd love you to see this. Stupid. Too much stress then. Like I should have waited. I may have already lost him. In preparation from this conversation, I reached out to him and just said, hey, man, how are things going? And he said, they're going pretty well. We're managing it okay. He's staying within the ranges that they wanted to be in. And I'm like, here we go. What does that make you think?
Yeah. First of all, I love the fact that you understood how challenging it was for that father to deal with any more new information in that moment. So when a lot of our children who are diagnosed with type 1 diabetes are diagnosed with a condition called diabetic ketoacidosis. And basically what happens is the body stops being able to use fuel for energy. So in order for us to be able to use the fuel that comes from the foods we eat, or even the fuel that's already within us on our own body, such as fat storage or fat cells, we need insulin. We need the hormone insulin. So when type 1 diabetes develops, we lose the ability to secrete the hormone insulin. And if that isn't caught on time, the body actually cannot use its fuel sources. It starts to lose weight. People start urinating often because their kidneys are trying to get rid of the excess glucose that starts to rise in the bloodstream, because that glucose can't be used for energy, can't go into the cell. And with children, it happens very quickly. Like, it can happen, the onset may take a little bit of time to get there, but all of that is hidden. So when it happens, your child can lose weight very quickly, go into diabetic ketoacidosis. Often, the medical establishment will miss the diagnosis. It presents like a flu, and you've just seen your child get sick, and then maybe after a few days, they just seem to get more and more sick, and they start vomiting, and they start getting very lethargic. And, within a week or so, it's even life-threatening. And so as a parent, you're in shock. you feel terribly for your child. And there's a lot of there's shock at the diagnosis of type 1 diabetes, and then there's this grief and this, how did we end up here? So I just wanted to comment on that first, Casey, because I mean, every parent and every child remembers diagnosis day. And every adult who has been diagnosed with type 1 diabetes remembers that day. It's almost like my son was diagnosed 10 years ago, and I sort of picture myself as, floating above the room in the ER, watching everything happen 10 years later. I can still visualize it all. And when the doctor says, oh, the blood glucose levels are high, your son has type 1 diabetes, you're going, what does that mean for me? How does this work? And then there's a lot of education that occurs within the hospital. So they, the doctors have in acute care do an excellent job of rehabilitating the child, and getting them back online. It's just that we then have to learn how to start giving insulin injections, and taking in everything that doctor's saying. And it doesn't make sense to us at first. And the challenge is, this is a this is a big story. The challenge is we not only need to start giving insulin and learning to give insulin injections for our children, but we start learning everything that affects type 1 diabetes. So you learn to give the insulin injections, and then every time your child eats, your child needs insulin to metabolize that food. So when you reached out to your friend, I'm sure you were thinking, let's actually try to help you feed your child in a way that will make type 1 diabetes easier to manage. I'm going to make that assumption. And yet the medical establishment, the conventional medical realm, has guidelines that have people with type 1 diabetes eating foods that makes blood sugars spike, and then they have to use insulin with that. So it's really very a confusing time for parents. But I actually think your intentions are wise. And if people can learn very quickly how to manage type 1 diabetes in a way that makes blood glucose levels easier to manage, everything about managing type 1 diabetes gets easier. And I guess, we'll get into that more today.
Yeah, absolutely. The intention was there. Again, the timing was totally stupid. They're all confused. They're in the moment. The doctor's telling them one thing. I'm a schmuck he hasn't talked to in 20 years. Of course, I wanted to send him something useful that he could watch when time was there. But again, like you hear what he says back, and like he's in the range that they want him to be. The range that is acceptable by the medical establishment it's insanely wide. And it's so crazy. So yes, we want to get more into that. But before we do, you've already kind of shared, more of a kind of general thing that happens with parents of diabetics. But let's go into specifics with your own personal story and what that looked like for you.
Yeah, and maybe I'll do that, to try to, walk the listeners through, well, what do you mean when you say, well, the blood glucose targets are too high in type 1 diabetes, and they're going to lead long-term to diabetes complications, such as blindness, kidney disease, and et cetera. So maybe I'll try to, tackle those both as I tell the story.
Great.
So my husband and I have 3 children, and Lachlan is our middle child. He was 9 years old when he was diagnosed with type 1 diabetes. We were fortunate in that he actually didn't end up in diabetic ketoacidosis. As I mentioned, one of the symptoms of type 1 diabetes is urinating frequently. And I noticed Lachlan had been up in the middle of the night 3 times one night. And I remember saying to him, Lachlan, what are you doing, honey? Like, just, stop going to the washroom, go to bed, what's happening? And he goes, Mom, I have to pee all the time. And so I said to my husband, I think I'm just going to take him in and maybe he has a urinary tract infection or something. I better go check that out with him. So we actually ended up, he did not have a urinary tract infection. He had type 1 diabetes, but we were fortunate in that he wasn't actually severely sick and had gone into diabetic ketoacidosis. So what basically happened is I took him into the emergency room that day because it was Labor Day Monday in Canada. It was the last day before school, before I entered grade 4. We had the diagnosis of type 1 diabetes. Obviously, we were in shock. I mean, I remember being in the ER going, what is this? Like, what? I kind of remember reading a little bit about this when I was a kid, because we used to call it juvenile diabetes when I was growing up, but I really had no idea what was in store. So the next morning, we lived in a small town in Ontario, and they sent us to the Children's Hospital of Eastern Ontario, which is in Ottawa. And we had 1 week of diabetes education. And that typically, is ideally what happens when any child is diagnosed, that you have diabetes educators, nurses, dietitians, endocrinologists that teach you how to manage type 1 diabetes. So we went, and the first thing that we were told as soon as Lachlan walked in the door, the nurse said, "Don't worry, Lachlan, you can still eat anything you want." And I remember at the time going, what does that even mean? Why would he say that to us? Why would food change? That I remember it so clearly because everything was so confusing. So when you first go into diabetes education, they say, okay, here is what we're basically trying to do is now manage your son's blood glucose levels, because now that he can no longer produce insulin from within his own body, we're going to have to inject a medication called insulin, and you're going to try to balance the blood glucose levels. And the goal is to try to balance them the best you can. And you have to make sure, though, that his blood glucose doesn't go too low, and it doesn't go too high. Because if it goes too low, he could actually, he will feel terribly. He could even have a seizure. And if it really doesn't get treated, he could go into what's called a diabetic coma and die. So, of course, as parents, that sounds terrifying. And then on the opposite side, if we go too high, that leads to the long-term diabetes-related complications over time, blindness, kidney disease, nerve pain, etc. So right away, you realize, well, we're sort of on this tightrope. And so in order to give you a little bit of space to walk along that tightrope, in Canada, we're told keep the blood glucose levels between 4 and 10 millimoles per liter. In the United States, that's 70 to 180 milligrams per deciliter. And, try to keep within, those are the targets, for your child with type 1 diabetes. And so you think, okay, so those are the medical guidelines, away we go. Then they teach you to inject insulin. And then they tell you, we can still eat the way you normally do. And they explain to you what carbohydrates, fats, and proteins are. And you say, we actually need to dose the insulin for mealtime based on the number of carbohydrates. So we'll need him to eat this many carbohydrates. And I remember when we finished with the plan for the week, we had the most lovely dietitian. I still to this day, I think she's the nicest person probably I've ever met. But we put together what he was eating, and it was like over 200 grams of carbohydrates per day, right? In this 9-year-old. So my husband and I were like, right, we just have to do the math. We have to count the carbs. We have to weigh the food, and we just follow the instructions, and away we go. So the father that you reached out to is dealing with all of that in week 1. And pretty soon you realize as a parent, oh, I'm doing the math. And yet, even within that 4 to 10 range, that 70 to 180 range, his blood glucose levels are bouncing all over the place. And it's pretty stressful.
Wow. Okay, so I want to point something out. Also, I just want to point out that at the time you heard the introduction when we said you're a nutritionist, a dietitian, you're licensed, all this stuff. That was not at the time.
Yes, great point. So no, I was completely clueless. And I mean, I tell people this all the time because I remember saying to a friend, maybe a month after Lachlan was diagnosed, he said, "Oh, what are you doing right now?" And I said, "I'm getting a PhD in type 1 diabetes. Like seems like my full-time job." But I had come, I had worked in international education. I'd worked for the federal government in Canada. I had no science background, like nothing since high school. I was an arts major, I had a public policy degree. So I actually, after about a year after Lachlan was diagnosed, I started taking some nutrition studies because I we had, I'm skipping around in our story a bit, so bear with me, but we learned about the foods that worked better for Lachlan's diabetes, and we managed to have a lot more stability in blood glucose levels, but I couldn't understand what was happening in the body still. I still felt like, well, how are we doing this? Like, how does the pancreas work? How does everything work? And how does food interact with how the body works? So I then went and did my Master of Science in Nutrition and Integrative Health.
Got it. I wanted to
Yeah.
point that out. I also wanted to point out if there was a super, super nice, dietitian in Canada
Yeah.
that's amongst Canadians, you're talking about way over the top nice. You're already talking about very nice people, and she's even nicer than that. That's like
Yeah.
a
Yeah.
next
She was
universe
so
level
nice. Yeah. And
of
and
nice.
Lachlan's diabetes nurse, they were we felt very fortunate. I mean, Lachlan still has a place in his heart for the nurse that day, who was the most loveliest man ever. And, and I really think that people in a I think people who go into work with especially children with type 1 diabetes, the majority of them are absolutely lovely people who want to help people with type 1. And when we went back to these people a couple months later, and I can probably get to that in our story, going, okay, this doesn't work, and we've heard that you can reduce the carbohydrates to make life less stressful. They were actually open-minded and welcoming, and they helped us do
Wow,
that. But
that's amazing.
the conventional approach is not to teach that from day one.
Got it. Yeah, and even the what you're describing, I've never heard of before. Having an entire week is way more comprehensive than anything that I've ever heard of, regardless of the information given. That's, I mean,
Mhm.
still is very, very comprehensive. So I like that. This really occurred to me, as I'm talking to Bethany McKenzie, and especially the people like R.D. Dykman, and like
Mm.
you maybe didn't have the background in diabetes care, but you're talking to two very smart parents. Like RD and his wife are both doctors. Bethany's husband
Mhm.
is a doctor. Like these are not idiots. These are smart people who are good at things, and they care. They're caring parents, and they're loving, and so they get the math,
Yeah.
they get the numbers, and it's like, okay, got it. I'm on this. We can sort this out.
Yeah.
Tell us what truly like a normal day of the life is for the entire family when somebody is suffering with type 1 diabetes and they are following the standard conventional advice.
Yeah. It's a great question. So I remember, I mean, there's so many different elements. The hard part is there are so many things that affect blood glucose. So you could provide the same meal to your child day in and day out at the same time of day. That helps, right? The body likes consistency, right? And type 1 diabetes really appreciates consistency. But there are so many things, like did Lachlan run around at recess, or did it rain that day and he stayed in? So he's less or more insulin sensitive, right? Because exercise and improves insulin sensitivity. They're just there are just so many things that affect it. So it constantly changes what happens on a daily basis. And so when we started, I remember it was only day 3 after diagnosis. And I tell this story often, but you have to give, when you are having quite a few carbohydrates at the meal, you actually have to give your child the insulin injection 15 to 30 minutes before they eat, so that the insulin medication has time to take effect, so that when the food's effects hits, you're trying to match that. Okay, so it may already sound crazy to you to say that, but there's all these issues with insulin variability too, right? So Casey, think, like, there's so many decisions a person with type 1 diabetes has to make on a daily basis. If I inject insulin into Lachlan's stomach or his arm, I get different insulin absorption rates. If I'm having 5 units of insulin versus 1 unit of insulin, the variability of what can actually happen once the insulin is injected changes. There are also many different types of insulin. So you have to understand your child's particular insulin profile. and how it works. When does it start to work once it's injected? When does it have its peak effect in the body, like its strongest, most potent effect? And when is it considered having, left the body? So all these things are going through your head as you're trying to do this. So you go, I can do the math, I can figure all this out. And then you're on this roller coaster. So it's day 3 after diagnosis. We've injected the insulin. We've counted the carbs. I've given Locke a wrap with white rice and chicken and vegetables inside. And halfway through the meal, he says he's full. Well, I've already dosed the insulin. So we said, you have to now, now I go, okay, I'm going to have to give him some glucose tabs to make up the difference. But, you don't know that. A lot of parents are still, and we forced him to finish that meal, and he's crying because he doesn't feel well because he's continuing to eat the meal, but we've injected the medication and we can't risk his blood sugars going low because he had too much insulin for what he was eating. So that's like a typical day with type 1 as you kind of learn this. And so, when I think about people like Bethany and RD, and we're all trying to do the math, but there are just too many factors that make type 1 hard to manage. Now, if you decide that you want to stay between the conventional blood glucose targets of 4 to 10 or 70 to 180, it's easier. It's easier. But when parents realize, well, that's not going to prevent complications, we actually have to try to mimic what the body normally does to maintain health. And for me personally, I saw a grandfather lose a foot when I was a teenager from type 2 diabetes. So I knew what like, my grandfather was diagnosed with type 2 diabetes in his 50s and lost that limb in his 70s. So I'm like, well, my son was diagnosed when he's 9. I can't have him high blood sugar, or I know what his fate will be. So, when you are trying to get closer down to, like, I want to have my child more between 4 and 7, or between 70 and 120, 130, that's harder to do unless you're very strategic with the inputs you put into the body. And the one input we have the most control over is the food we eat.
Wow, it's so powerful. Before we get into some of the solutions, I want to see this from Lachlan's side as well.
Yeah.
I've heard you describe, like, there are behaviors that come along with every child that has bouncing blood sugar all over the place. What are some of those behaviors? And then also, we kind of have this term called diabetes distress, and it relates to, again, what I would argue is everybody in the family. The day you got that diagnosis, you as the mother just got a 24/7, 365-day-a-year job. You don't get a break. You don't get a vacation. You don't get to sleep easy at night. Your husband the same. It affects everybody. And the idea that, like, the kid, he's aware that he's affecting the rest of the family as well. Like, how, from his point of view, tell us some of the things that he's experiencing as he's going through this.
Yeah. I'm really glad you brought that up, because it can be hard to understand if you don't live with type 1. And especially when people say things like, well, you're restricting the diet, right? That you shouldn't do that with the child. And I'm like, do you know, like, there are so many flow-on positive effects for the family. So, first of all, we have 2 other children. So those 2 other children are, along with Lachlan, they are picking up on everything that my husband and I are going through, right? The stress of this and trying to learn everything. So of course, in the early days, our kids are hearing mom and dad go, I don't know, how do we do this? Or what, my 11-year-old daughter became the designate, let's sit with Lachlan when he's having a low and talk with him and try to make him feel better. And everybody's sort of panicking and trying to get glucose into this kid because you're trying to make sure that he doesn't have a seizure, and everybody's sort of terrified. So everyone's on pins and needles. And from Lachlan's perspective, first of all, Lachlan is a very chilled kid. He's a go with the flow. He can handle a lot. I think that has really helped him to manage type 1, although it's still unfair that he has been diagnosed with this. It's been one of the things that has helped. But one thing he doesn't like is to stand out. And so as soon as he went back to grade 4, and the teacher explained to everybody, because he had missed the first week of grade 4, you know, Lachlan's coming back to school. He's going to need to get insulin injected at lunchtime. And so she's, you know, everybody wanted to help go get Lachlan's lunch from his locker, which would save him time so he could do his insulin injection. It was the sweetest thing the kids could do. And Lachlan hated it because he's this 9-year-old boy that's like, I'm normal. You don't have to do things for me. And then every time he goes to the bathroom, in case he's having a low, because this was in 2015, so we don't have CGMs yet. We don't have continuous glucose monitors attached to the body so we can see what his blood glucose levels are, right? It was only a glucometer back then. So nobody knows really what his blood glucose levels are, except for the 4 to 8 times you're testing per day. So he can never go to the bathroom without a friend. Because if for some reason he has a low and passes out, we don't want somebody to not know that that has happened to him and run for help. So he had, you know, all of those types of things kind of came with it. It's probably not as relevant now if a child has a CGM and everybody feels like they're in range and feels confident. But those were the types of things. The other things too is when he would go high, I remember Casey, it was so bizarre to me. He was 9 years old and he would talk like in this high-pitched voice, almost like a baby talk. And he would immediately fight with his younger brother. Like he would get mean. And I never clicked in that it was blood sugars in the beginning until we stabilized his blood sugar. And then he never talked in that weird voice again. And he didn't fight with his brother. And we would know sometimes, like once we actually changed his diet and we had more stable blood glucose levels, if he ever picked a fight with his siblings, we knew to check the CGM right away because he wasn't feeling well and he was irritable and quick to anger. And he's a really chilled out kid. Like he's not a kid that tends to, you know, fire quickly. And then when they go low, this doesn't happen often, but they shake and they don't feel well. They feel very nauseous and they want to lie down and just fall asleep. So you really want your child's blood glucose levels to be as stable as possible, just, you know, for them to feel better every day. So those are some of the things. Even now, like Lachlan went to university this year for the first time. So you have to tell all these new group of friends, you know, I have this. And if I ever ask you for, you know, to help me, or if you ever see me go unconscious, I actually need your help by reviving me in this way and calling, you know, in North America, 911, in Australia, 000, you know, the emergency hotline. So all of those things, you know, he's still navigating as a young adult. And you know, that's challenging. You just want to go off to university and have your friends go, oh, you're the nice guy down the hall who's studying business, you know, not somebody who has a medical condition that you need to know about. But it was nice, actually. I noticed he was telling me a story about one of his friends that he lives with he's in a residential college on campus. And he said, oh no, all my friends know my iPhone PIN number because just in case if they ever want to check my blood sugars. Right. So I thought, well, how many, you know, to him, that's a safety thing. And for me as a mom, that's a comfort thing that he has obviously, you know, explained to his friends. Here's how you open my phone. Here's how you check my blood sugar. And here's how you help me if I ever did become, you know, unable to help myself.
Yeah. Wow. Thank you for explaining all of that. I remember you commenting, maybe it was on the Low Carb MD podcast with Tro, that like also for Lachlan as a kid, you like the siblings, right? You pick up on the stress of the parents and you know it's your fault. Like this is me doing this to my parents. And again, even at a very young age, he must have been feeling that. And I'm glad you commented on that because I had never thought about that specific angle before. Yeah, challenging. Okay, well, this is obviously a success story at some point. So what was the turnaround? How did you find different information? And I don't know. I dance between the idea that like this is so hard to manage. I would do anything, but also that the consequences of going low are, fatal. And that's the only thing, you don't understand exactly what the science is on how you can keep the blood sugar from crashing so low at the time. It would be very scary to try something. So again, I dance between like
Yeah.
finding new information and I'll do anything versus like, wow, if we goof this up, this could end very poorly. What was that situation like for you?
Yeah. So going back, so Lachlan was diagnosed September 2015. For the first few weeks, we followed all of the information. And I do think the Lachlan's diabetes care team thought we were doing really well. And, we probably were by those standards. It just sort of felt like everyone was on edge in the family. And we were like, is this really the way this works? Like, this doesn't seem to make any sense. But we couldn't figure out, and like my husband Matt and I were like, kept saying to her, like, what are we doing wrong? Like, why does blood sugar still go so high and then drop so fast? You know, um, and we just didn't like, there seemed to be no predictability whatsoever. And then my husband was, doing, all night Google searches all the time. And this is 2015, right? So there is no Let Me Be 83, and there's not a lot of information online. And he stumbled on a low carb down under YouTube presentation by Dr. Troy Stapleton, who's a radiologist, actually here now where I live in Australia. And he got diagnosed as an adult and had reduced carbohydrate. So he talked about how much that stabilizes blood glucose levels. And he mentioned this book called Dr. Bernstein's Diabetes Solution. And so we ordered the book off Amazon, and it came, and it almost looks like like a Bible. So it's so thick. And that was daunting, but we made our way through that slowly. And we thought, well, could we reduce the carbohydrate? That would seem to make common sense, but we were really worried Lachlan wouldn't grow. And we weren't, there didn't seem to be any information on whether this was okay for children. So we did it, and we were worried. So we did go back to the Children's Hospital of Eastern Ontario. We had this lovely endocrinologist she couldn't have said it better. She said, I've never had any family that's done this before. She was in her residency. She was young, and she said, but I'm happy to help you. Let's work with the lovely dietitian, and we'll make sure that, he's getting the nutrients he needs. And we just have to make sure that we change the insulin. Like, we would really need to reduce his insulin if he's taking in fewer carbohydrates. So they did that. So my husband actually went keto for a month himself. And then we did a start date where the whole family transitioned. So we went and we cleaned out our cupboards. And I should tell you, Casey, I was going, well, I didn't understand the body. I was trying to understand everything. It's probably only like week 6 after diagnosis. I'm like, why are we doing all this? Like, as if this is going to work. I didn't really have much faith in it. We just heard one YouTube video, and we knew no one else who was doing this. So we did it, and then we started checking blood sugars after we reduced the carbohydrate, and it was night and day. And I remember, like, 1 or 2 days in, I literally went, oh, wow, okay. And I said, this might be challenging from a social perspective. Like, how do you go to family dinners now? Because the food is a little bit different than what our extended family currently eats and what we normally eat. But the blood sugar just started staying in this really steady line. And we, keep in mind, Matt and I still don't really know what we're doing, right? But the fact that we were reducing the foods that had a high glucose load, like, what people don't understand is all carbohydrates, whether they're like, candy and chocolate, or whether they're fruits and vegetables, or whether they're rice bread or, pasta, everything turns into glucose molecules when it hits the small intestine, right? I mean, yes, there's other one sugar molecules, but the most abundant of which is glucose. So that just adds to the glucose load in the bloodstream. So if you reduce the molecules coming into the body, it makes it easier to manage type 1.
Yeah, but you don't want them on a restrictive diet though, you know. You don't want to get like an eating disorder. Oh my goodness. It's crazy because when you get on the other side of it and you learn this stuff, you you're just like, well, yeah, like of course that would have worked. But it's so challenging in the moment because you think like, well, if that could be
Yeah.
an option, somebody would have surely said something at some point. Like it's yeah, it's just so wild. It's such a wild topic because like when you're in the middle of
Yeah.
it, it's so confusing, and you think you're going nutso by you know it's like Dave Deckman when you know at whatever age he was 9, 10, 11 when he's like, oh, I'll just
Mhm.
not eat the carbohydrates. Like,
Yeah.
well, like
I
come
know.
on.
I love that story. The child figured it out before any of us did, you know. Yeah, it is a common sense approach. I think when you've been it was really helpful actually to do my Master of Science degree because I'm coming in as a mom who's used food for a medical condition. And I'm like, okay, how is this taught? And then you get in there and you understand it, like, you know, the biochemistry and everything is fascinating and makes sense. But then all of the nutrition guidelines, I'm like, well, wait a minute. We just came out of biochem class. This doesn't make any sense anymore. You know? So I think when you're taught that, you don't why would you question it when you're like, you know, okay, like you know, you walk around as a parent all the time going, well, I must be the one who's wrong because why wouldn't they be teaching me this? You know, so it's hard for parents. So the approach that I try to take now with healthcare professionals is, look, the American Diabetes Association and Diabetes Canada talk about the fact that people with type 1 diabetes and type 2 diabetes have food preferences and they have choices. And I really think we have to drive home the fact that type 1 diabetes is a self-managed condition. It is not managed within the walls of a clinic. You can't go to a doctor's office and they say, take 2 tablets and come and see me in a week. It doesn't work like that. People are given a life-saving medicine, insulin, and they have to understand how to use it to keep themselves safe and healthy. And then they have to be taught, okay, so what are all of the different ways that you can manage your type 1? So we need more diabetes education to give people competence and confidence in what they're doing on a daily basis, because people with type 1 can tell you, even if they haven't had that, you know, that 1 week of diabetes education that my family and I were, you know, blessed to have, you learn over time through lived experience what works and what doesn't. And it's just that sometimes if you haven't been given the option of things like a low carbohydrate diet, you just don't even know that's an option to you. And so I always think, you know, people don't have to follow a low carbohydrate diet if they don't want to, but I think they should at least be given the choice to know that this is one option in the diabetes toolkit that they can choose to make. And if people decide that that's not for them, then I say, great, you have independence and choice over how you want to manage your own condition.
100%. Yeah, 100%. Compliance, not only with Lachlan, but you know, yourself, trying a new diet, the other
Mhm.
kiddos. Like, what was the compliance like?
Yeah, this is a huge topic and I see it a lot with my clients. It's challenging. I mean, there's so many things involved. We were very fortunate in that, well, and I should say I was very, my husband cooks. And I'm not a great cook. I always tell people that I am not a great cook. I am a recipe follower. If I can do this, you can do this. I don't want you to think that we've come from like some cordon bleu restaurant and we're doing this. No, they're simple meals. But it helps when people cook. And sometimes compliance, I hate that word compliance, but being able to stick with this and have it be sustainable is easier when you have some skills. Like I find that people who cook adopt the low carbohydrate approach a little bit easier because in the kitchen they feel comfortable generally. So sometimes we have to work on that. I think compliance can be really hard when you go outside your comfort zone. So families kind of learn to eat within the home and they do okay. Um, Lachlan took to it right away because, you know, he he loves protein, he loves meat, he loves chicken, you know, he eats some fish. All of that wasn't too hard for him. And I baked my face off for the whole first year, trying to give him every kind of alternative available. I mean, and we did it for all three kids. So all of our children were doing that the same way. There's definitely some children who take to it more easily than others. So we have to work with those children. So a couple of things that I say to families, because so many people come in and say, my child's never going to do that. So I say, okay, we have to be really smart. Carbohydrates taste amazing because they literally turn into glucose in your mouth. So you get that sweet, lovely, you know, hit of dopamine and it tastes great. So what else do we have to use? Well, we have fat. Fat also tastes good. So we have to actually introduce foods that contain fat for our children. So they're going to enjoy the food they eat. And we also need to be a little patient because I find it takes 3 to 4 weeks for taste buds to start to adapt.
Mm.
So, and a lot of people start right away with, I'm going to take my high carb bread and offer a low carb bread. And then they keep saying, Beth, my child hates this food. I'm like, yes, because your high carb bread is full of glucose molecules that, you know, dissolve in your mouth and taste amazing. And your low carb bread is not full of glucose molecules. So we don't want to do that high carb to low carb replacement from day one. Usually we really want to start with more natural foods, you know, where we're using protein foods and fat and those kinds of things to help with compliance. And then I think we really need to explore the emotional side of that. Like, what's hard about this for you? And I find it's different for everybody. Some parents go, yep, I just made a low carb cupcake and sent my child to the birthday party. Other parents are at the birthday party just emotionally distraught that their child is being left out, or they don't know whether they should eat the high carb cake. They don't know what to do. And that's normal. I mean, I would be 2 years in, Lachlan's been eating low carb. I've sent him with a low carb cupcake and I'm at the birthday party going, oh, why can't this just be easy for once? Why can't he just have a stupid cupcake like everyone else? And I didn't have to make another batch and you could just send him to the party and not worry about it. But it's really it's really about your mindset, right? What you decide to do. And interestingly, in our family, we just decided we're going to send food with Lachlan and he'll eat that food. And after a while, Lachlan would say, oh, can I eat before I go? And then just not eat food when I'm there. I would prefer to do that. Okay, great, Lach. And I said, you know, does it make you feel badly that the people are eating other foods and you're not eating those? He goes, no, but sometimes it makes me feel weird that I'm eating different food to everybody. I'd rather just not eat. This is when he was a bit older. We said, okay, great. That's up to you. And then I asked him just last year, do you remember when you went to the birthday parties and you had to bring your own cupcakes? And he was like, no, did I do that? Like, he doesn't even remember. You know, and so here I was at the birthday party kind of screaming on the inside. and so his experience was different. But there will be children who want to eat the cupcake at the party. And so you need to decide as a family and you need to be clear, how are we going to handle this and what are we going to do so the child understands the expectations. And it's not confusing because you will have these different scenarios. Like I have one family and they're Italian. And every Christmas, they all make pasta together. So now what happens in the extended family is like, well, aren't we going to make pasta anymore? You know, so these are really challenging. This isn't really like having to manage type 1 opens up this whole other realm of all these other scenarios that families need to navigate. And getting back to your point at the beginning, Casey, we never want to make the child feel like we can't make pasta at Christmas. So now what do we do, right? So those are all things that we really need to support families with type 1 to build up that resilience. And I have parent groups and we talk about these things, right? There's no right or wrong answer. Let's get it out. And people just love to know that they're not alone in those moments. It helps a lot.
Yeah. I So much love that perspective. We talk to a lot of people around here, again, who are
Mhm.
kind of on the other side of things. Their kids are now athletes. Again, Bethany and RD, their kids are doing really well. Your kid is doing super well. And so you hear the kids that just adapt, they start eating a lot more meat, they eat a lot more fat, they end up preferring it. And what you said earlier is right. And what you just said is also right. Like this is not fair. It sucks that you can't go to a birthday party and not have a normal stupid cupcake, like you said. And the flip side of that, like the optimist says, well, at least these kids are going to be super healthy, a lot healthier
Mm.
than they would otherwise be because they understand this at such a young age. I mean, look at Dr. Andrew Kutnick. He was like, yeah, I would rather not deal with this, but at the same time, at least I understand this. And dude's jacked and he gets to do all kinds of stuff that, if he was eating the intermittent cupcakes, maybe he wouldn't be able to do anyway. So yeah,
Yeah, yeah,
it's
and
so
it's
interesting.
true. And I do find over time, everything gets easier, right? Like it's a habit. Like I definitely in the first year would feel like, oh, I wish I could just eat this. And now you couldn't pay me to eat that. Like
Totally.
I just don't feel like it. And I'm not against it. And I don't, if someone's eating it beside me, that's totally fine. Like I don't judge anyone else. I don't even notice anymore. It just takes time.
Good point. Yeah, good point. The number of times my clients tell me, look, I'm going to this wedding, I'm going to have the cake. I know I'm going to feel terrible for 2 days, but I'm going to eat this cake. And they come back and say, not only did I feel terrible, but the cake wasn't even good. Like, it didn't even taste good. And we get that all the time. Okay,
Yeah.
I want to make sure I read this so I don't goof this up. The Nutrition Effect, a Parent's Guide to Food and Normal Blood Glucose for Children with Type 1 Diabetes. This is
Mm.
amazing. What was the idea around getting this out there? This is how should we say this? Is this a consensus statement like the SNHP, or like what do you call this first of all?
Yeah. So this was a program that my husband and I came up with for families simply because we wished it had existed when Lachlan was diagnosed. Like we were looking for something. Type 1 diabetes is a puzzle, and over time, you put the pieces together. And I just wish that the pieces had been put together a little bit for me because you learn as you go, and it's this kind of multi-step process. And yes, you can't take everything in at once, just like that father that you reached out to, because it's just too much all at once. And it will, people often say it takes a good year to sort of get your footing. But we created the Nutrition Effect to try to introduce, like, so what are we aiming for in terms of blood glucose levels? How does insulin work? And now, why would we use nutrition to help us get to where we want to be? And then what does that look like on a plate? And I created it about 2.5 years ago. And I'm just in the process of updating it because our most popular programs are actually the group love to be surrounded by other families. I'm actually going to release an update in November. And I'm hoping that I can now start doing age appropriate parent groups, that we're getting busy enough for that. So I think that was just my way of trying to have other families not try to have to piece the puzzle together. And that's why we offer that. And then, um, you know, I've also been working at the Type 1 Diabetes Family Center here in Australia. And they do, almost everyone who works there has lived experience. They totally get type 1, and they are really about education and community support. So my colleague Amy Rush and I actually just presented at the Australasian Diabetes Congress last week here on the Gold Coast, and we had a
Amazing.
packed room for their carbohydrate reduction in type 1 diabetes. And even we were going like, my colleague Amy was like, don't worry, Beth, the room will be full. But people had to not come in because there weren't any chairs left in the room. So I
Amazing.
think that healthcare providers really want to be able to help people with type 1, and there's not enough information about that. And that's why we also drafted, there's the Society of Metabolic Health Practitioners paper that Dr. Kalajian led last year, which is a number of clinicians saying, please, if someone with type 1 diabetes comes to you and wants to do this, help them with a low carbohydrate strategy and allow them to do it and provide support. And then also, we have a set of guidelines for dietitians and nutritionists, a guide for dietitians and nutritionists at the Institute for Personalized Therapeutic Nutrition in Canada, IPTN. They sort of sponsored us. So it was Dr. Caroline Roberts from Verta Health, Amy Rush, Franziska Spritzler. She's a registered dietitian and CDE, and myself and Dr. Andrew Kutnick. So we put it together, fully volunteer effort. And we were just like, the guidelines are not changing. And people with type 1 are already doing this. And healthcare providers are confused as to how to help them, how to adjust insulin, how to support them. So there are many resources that are starting to come out that are available now. And the session that Amy and I had last week at the Australian Diabetes Congress, I mean, it was so the vibe in the room was amazing. Like, we tried to make it interactive. We did role plays. We explained, well, how do you dose for protein and fat, which is something a lot of people, get confused about when making insulin adjustments. Because in type 2 diabetes, you can say, you know what, try this for a week. In type 1, you have to go, okay, try this for a week, but we have to explain to you how your insulin needs will change. Because if you dosed for those meals using your high carb meal amounts of insulin, you would have hypoglycemia. So we need to make sure that you adjust your insulin and know how to do that before you make those changes and lower your carbohydrates. So yeah, it was great. The vibe in the room was fabulous. We had all these people coming up to us after saying how much they appreciated it. So I think people are looking for more information.
That's amazing. Okay, so when I asked the question, I got confused. The nutrition effect was different than what you just mentioned, the paper that came out with the 5 of you all contributing.
No, sorry. So the
that's where
nutrition
I got
effect is
confused.
the nutrition
Yep.
effect is my practices program for parents. It's an online course for parents. And then the guide for dietitians and nutritionists is that volunteer effort. Yes. Yeah.
Got it. Okay. I love that and I appreciate that. As you and Tro were talking in that episode,
Yeah.
Tro has his, personality, and he's such a nicer, kinder guy than he even makes himself out to be on Twitter. He's just very direct.
Oh, totally.
And this kind of got brought up in conversation. I think it's really, really important. When you came up with this guide, it's written in a specific way that, I mean, it's not exactly like, listen, you dopey doctor, you're doing this the wrong way, you idiot, like, do it this way so this kid can get better. You guys write it in a way that's very, very strategic. So can you talk about that?
Yeah. So I think that gets back to my earlier point. I had come into this as a caregiver, as a mom, and you're just trying to figure the food out from lived experience, every day dealing with type 1. And then I went to do my Master of Nutrition degree, and I loved my degree. It was clinical nutrition. My lectures were amazing. I loved everything about it. But all of the way that we count numbers in the dietetics realm, I was like, oh my, why are they making this so complicated? But I learned the clinical language. So we all knew that in order for clinicians to be able to use a document like Therapeutic Carbohydrate Reduction in Type 1 Diabetes, a guide for dietitians and nutritionists, we had to speak their language. So I've said, because many families are reading this, and I'm like, just so you know, it's written for clinicians. So it might feel like, why are they wording it this way? So we're trying to make sure that clinicians can understand, what we mean, because everybody has, there is something called the nutrition care process for dietitian and nutritionists. And when you actually walk a patient through whatever their medical condition is or whatever their nutritional needs are, you follow a step-by-step process. So we needed to make sure that the guide was aligned with that so it would make sense to dietitians and nutritionists. And we encourage people with type 1 to bring it to their healthcare professionals so that people are aware of it. I actually talked to one researcher last week, and she's done a clinical trial on low carbohydrate eating in type 1 diabetes in Australia. And I happened to hear a presentation of hers a few months ago, and I contacted her, and we met last week at the Congress. And she said that somebody referred her to the guide, and she went, "What? there are people working on this kind of stuff all across the world. Like, how do I not know this is all happening? So the other thing that we did was we put it out there so that if you are that one person, you know, her endocrinologist came to her and said, could you please do a literature review for me on low carbohydrate and type 1? I want to better understand what the research tells us. So, you know, kudos to that endocrinologist. And then this dietitian got that assignment, started realizing, you know, well, maybe we could do a clinical trial here. And, you know, I love the work that she's doing, but we also wanted those clinicians to not feel alone. And since then, like, the guide is being translated into French, Norwegian, and Italian. And we've had someone wanting it in Spanish. And, you know, so there is a need for it.
Love that. Yeah, I love that. Not only is it professionally written, but it's also written in a kind and kind of warm way that's not accusing the
Mm.
doctors of anything like malpractice. But it's like, if you're getting, you know, this, one of your patients, for example, bringing you this, it has to be received by the medical professional who, you know, thinks they got the education, they've got the answers and all that stuff. So I really like the style that you wrote that in.
Oh,
And yeah,
thank you.
just, of course, and just commenting on, you know, your this recent, um, you know, this recent experience you just had of like standing on stage. Were you talking to like a general, it wasn't just low carb people that you were talking to?
Oh yeah, here, I can give this to you, Casey. It's like cutting the, you know, the latest. So there were, so we counted the chairs before our session started. There were 180 chairs. There wasn't a chair available in the room that I could see. And then there were people standing at the back, not many because the room was small. So I would guess about 200 people in the room. And we actually asked people in an interactive poll who they were. So 100 of them were diabetes educators. The conference talk we gave was actually called Practical Strategies for Diabetes Educators. So that was our main target audience. And diabetes educators are either, they can have variety of health professional backgrounds. They can be nurses, dietitians, pharmacists, exercise physiologists. It depends on the country, but they can be from a wide range of background. But then they have diabetes specific training, and then they have to go through whatever their country's certification process is. So they've done a lot of work to get to where they are. I mean, I've done the training in America, and it is intensive. I don't agree with half of it, but it is intensive. And so we had about 100 there. We had about 20 some dietitians, 20 nurses, a few pharmacists, a couple of GPs, and unfortunately only one endocrinologist. The only thing that we have to remember is that there are 7 other seminars happening at the conference at the same time ours is, so people have to choose to come to one. So it would have been nice to have more endocrinologists in the room, but it was great to have all of those people. We also asked them at the very beginning of the session, so they haven't received any information from us yet, if one of your patients comes to you and says, I wanted to go do low carb for type 1, I want to try this, what is your gut reaction? So this is an anonymous, you know, poll. And surprisingly, I was calculating the numbers just yesterday. About 60% say, great, let's try it. Happy for you. How
Wow.
would you like,
Wow.
you know, and there were, I think, 22 concerns about things like ketones, but even some of the concerns were insulin adjustments. And I don't think of that as a concern in a negative way. That's very wise of that diabetes educator to say, well, we'll need to switch. Like, the first thing I think about is, okay, I'll need to work with this person to adjust their insulin. You know, so we were surprised by the fact that more people weren't hesitant. Some of the things that came out were, their gut reaction was fear, dread. And I really appreciated those comments, because it's like, yes, the reason that, you know, the Type 1 Diabetes Family Center and T1D Nutrition and Amy Rush, the reason we all want to put this on is to make you not be scared, because so many CDEs contact us and go, I don't know what to do when people need help dosing for protein and fat. I don't know how to do this. I'm scared that they're going to go low on my watch, and I actually don't know how to guide them. So we tried to be really specific. We gave them starting points for insulin adjustments. They're probably not going to be high enough but you be conservative at the beginning. You safely dose insulin. Probably the blood sugar is going to go high, and you observe it and you go, okay, next time I'm going to up my insulin slightly.
Your work's incredible. That makes me so happy and optimistic that more people are open to this than when your journey started. And hardly anybody knew anything about it. And there's a lot more communities and the Type 1 grid and all this stuff. And to be able to hear about you standing on stage and people being open and receptive to it, that's incredible. That makes me very, very, very happy. And that definitely wouldn't have been the case in the past. And I think people like you doing this work is moving this message forward. Again, maybe faster than I had anticipated. And it's an amazing message, and it's something that I love chatting about. And I'm so glad we were able to coordinate our schedules and set this up. It's been a long time coming, but it's been an absolute pleasure to chat with you. And I really admire you and your work. For now, Beth, where can people go to find you and connect with you and your work?
Yeah, absolutely. So I have a clinical practice called T1D Nutrition. Also, I do have a social media presence on Facebook, Instagram, Twitter as well, but I don't use that quite as much. And so people can get information from me there, as well as, contact me through my website. And I also work as the Director of Educational Services at the Type 1 Diabetes Family Center here in Australia. So we are actually creating education and starting to do that, through the center, and it's very exciting work. I'm really excited by some of the work that we're doing over at the Type 1 Diabetes Family Center, just to really help people understand that they can have more control in managing their own diabetes, and to feel that they can harness their confidence in that way. And then we're also I'll be speaking at the Australasian Metabolic Health Society next month. They have webinars. So we'll actually be offering that for their September webinar, and then Low Carb Down Under in October. So lots of stuff going on in Australia. I'm happy to report. I just moved here this year, so we'll see. It's, people seem to be open-minded, but I found them open-minded in the US and Canada. But mind you, if they're coming to talk to me, they're probably already open-minded. So we just have to try to keep breaking down those barriers. I do find my parents are saying that their child's diabetes care teams are more open-minded, which gives me hope.
That's great. Beth, this has been amazing. I really love your work, like I said, and thank you so very much for taking the time to be on our show today and share your encouraging and optimistic message around Type 1 diabetes. We really, really appreciate you.
Yeah, thanks, Casey, and thanks for helping us spread the message too.
Oh, it's my pleasure. Absolutely. And this has been another episode of Boundless Body Radio.